Every month, women and girls between the ages of 10 and 51 years go through the menstruation cycle. Although menstruation is a normal biological process, significant barriers to high-quality menstrual hygiene management persist across Kenya and remains a challenge for low-income women and girls. My name is Amy Moyi, and this is the menstruation burden on girls. In Kenya, 65% of people who menstruate cannot afford sanitary towels, despite the fact that the Kenyan government removed import and value addition tax on menstrual hygiene management products in the year 2011. In Mathare, an informal settlement area in Ngong Town, we meet 19-year-old Margaret Irungu, a teenage mother who, due to the high cost of disposable sanitary towels, has had to use homemade alternatives during menstruation.
Naitwa Margaret Njoroge. I'm 19 years old. Nakumbuka nikiwa kusaku kwetu, iko day nikianza kunyesha, mama kwa na do ya part, sikuwa na do ya part, sikuwa na anything. So ile kitu mtu anachukua ni shati, unakata shati, unaiweka, bacho shati ile imeisha, unatumia kama your pad. And unavaa pati mbili za black cause yatisipenetrate kwa nguo. So hiyo shati then saa zingine then nikapata mtu anatupea hii ya washable pads. So hiyo ndio kwa natumia. Iko kwangi comfortable. Nini inaweza toka, ijashikilia pati vizuri. Saa zingine blood inaweza penetrate, iharibu nguo yako. So it's not comfortable. Iko comfortable at all and at all. It's not comfortable.
The inconsistent water supply in informal settlements like Mathare make reusable sanitary towels that require post-use cleaning a less viable option to the disposable sanitary towels.
Maji ni shida. So unapewa tatu ndio unaosha, ukitumia unaosha unaianika. So hata saa zingine unaona tu kuliko kuiosha uitupe, utumie tu shati kila saa tu unatupa kuliko kutumia maji ovyo. Maji ni shida.
Jacqueline Seleyan founded a Pack a Month organization based in Kajiado County to fill the existing gap in adequate access to menstrual products, service and facilities, acquiring necessary information and education on menstruation.
My name is Jacqueline Seleyan. I am a youth whose resident county is Kajiado County, founder of an organization called A Pack a Month. A Pack a Month was born in around December 2018, after Kenya realized a surge in the teenage pregnancies, and that is when I decided to do research on what exactly was the cause for the rise in teenage pregnancies compared to the previous years. And it's from that research that I realized that some of the girls were having sex to get pads or to get money so that they're able to buy sanitary towels. The motivating factor was the fact that one, our girls were being exposed to early sex debut. They were debuting sex when they were really young. And for that, it means there are so many factors involved. Number one, the fact of course, getting pregnant. And getting pregnant means you have had unprotected sex. And when you have unprotected sex, you also have risk to sexually transmitted diseases.
Dr. Penelope's 2015 study of 3,000 Kenyan women found that 1 in 10 15-year-old girls is engaging in sexual activities to get money to pay for sanitary products, which poses a great risk to their health.
It is through the national government administration officers, like the chiefs and the sub-chiefs, that you are able to connect to community health volunteers, and it is from these community health volunteers that you are able to have a good grassroots data of who exactly is at the risk of having sex for pad.
Unaona saa zingine is a must utafute ka boyfriend ndo upate ka pad, utafute mtu huyu upate pesa ya pad hata kwa 50 bob.
The founder of Inspire a Teen organization based in Ngong Town, Susan Wairimu, says she has helped over 5,000 girls from vulnerable backgrounds access sanitary towels in an effort to eradicate transactional sex for sanitary towels.
I am the founder of Inspire Teenagers Foundation. I use my story to inspire the girls. I am a teen mom. I got my baby when I was 15 years old. Living in the Mathara slum, it's not easy. Sanitary towel is a basic commodity for any girl, and it is a human right, because each and every month as a girl you have to go through your menstruation, and if you're having a parent who's unable to provide that menstrual product, you're forced to go out. People look at 50 shillings as something very small, and actually right now it's not 50 shillings, it has gone to 60-65 shillings.
The national government, through the Ministry of Education National Free Sanitary Towel Distribution Program, distributes sanitary towels for 3.7 million girls at each sub-county level in public government schools across the country, but this is still not adequate to address the dire need for sanitary pads across the country.
I'm Bathsheba Nyaboke Osiemo, an Assistant County Commissioner 1 in Kajiado North Sub-County. The importance of them accessing sanitary towels. One is to enable them to be comfortable in school. One, to be able to concentrate on their education. Also, be able to be comfortable so that they can be able to live as a normal person. As well, there are so many challenges that come along with that if they don't access the sanitary towels. One, some engage in sex to access the pads. Others involve themselves in prostitution. Others even they indulge in sex with their own relatives. We've been tackling a lot of cases in this office when it comes to access to sanitary towels. Back in 2019, the government supplied sanitary towels to schools, especially to candidates who are sitting for KCPE. In our sub-county, Kajiado North Sub-County, we benefited, the 2,284 girls benefited, and they were able to be in school, and all of them did the exam.
18-year-old Anne and 15-year-old Akinyi from Mathare in Ngong narrate the challenges they experience in accessing sanitary towels, at times missing days from school.
Vile mimi naweza kumbuka, nilikuwa class 6. Naweza kuja niombe ama aseme ana, inabidi natumia tishu. Niliamka tafuta sanitary nikakosa, alafu sasa kabidi nikae niongoje, yani ninaweza ama nieke tu nguo ishikilie kidogo.
Why is access to sanitary towels still a challenge to girls despite the numerous intervention from non-governmental organizations and governmental organizations?
Sema umereceive period yako na una hiyo 50 bob ama hiyo 70, uende kwa duka ukope, utanyema hiyo pad for real.
The biggest challenge to the noble efforts from government and non-governmental organizations in providing menstrual hygiene management products to women and girls of low income is supply challenges that prevents young girls from accessing these much-needed products. The closure of schools in March 2019, when the COVID-19 pandemic hit the country, further halted pad distribution.
We are still waiting for government to continue with the same program in supplying sanitary towels in schools. But currently, as a sub-county, you cannot say that we are only waiting for the national government to provide for us the sanitary towels. So we've come up with different initiatives. For example, we can say that in our sub-county, we have NGOs, we have CBOs that are working closely with our office to support the girls.
The shame and stigma attached to menstruation, often due to harmful social and gender norms, creates a barrier to menstrual hygiene management in Kenya.
Once we involve the boys in these conversations, we are able to ensure that we end the kind of stigma and shame that comes with periods for the young girls. So we just engage them in a very interactive way.
The Kenya government, through the Ministry of Public Service and Gender, launched the Menstrual Hygiene Management Policy Strategy 2019-2030 that seeks to ensure myths, taboos, and stigmas around menstruation are addressed by providing women, girls, men, and boys with information on menstruation.
Come to our offices, express yourself, and you'll be assisted instead of indulging yourself with sex in exchange for pads. Young girls, you're priceless.
The Menstrual Hygiene Management Policy 2019-2030 marks a milestone in the country's movement towards achieving sustainable menstrual management focused interventions for women and girls in vulnerable situations by 2030.